Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about LMNs or PLMNs. PLMN. I used to call them LMNOPs in practice, but a patient letter of medical necessity is a PLMN. Um, I've had plenty of patients ask me for these, and sometimes they work, sometimes they don't. I mean, to be honest, I'm pretty straightforward. If I don't think it's going to benefit, I'm just going to tell them, I'm sorry, I'm not the right person for this. This will not benefit you in any way. And then they may get upset, but um, better than writing a bad one that's not going to help them. So let's talk about when LMNs work. So a lot of times people want to get an LMN or PLMN or an LMNOP when they've been turned down for orthodontics. Maybe they have like an HMO, or maybe they're aged out of getting orthodontics for their insurance. I mean, most orthodontic insurance, the way it works is it pays for a set lifetime fee or a set percentage, which is usually really small, and barely covers anything. So really, orthodontic insurance is not very helpful in most circumstances. Occasionally, someone has an amazing one that pays 5,000 or pays 100% or whatever. Usually you don't need a pre-auth unless you don't have good insurance or unless you're very old. And ortho insurance for most companies has an age cap at 18, 21, 25, 26. Occasionally you'll have one that has no age cap. But these are just things you need to look into. Don't assume because you have insurance that you can always use it, because it can go away or it can have an age cap. And there's some insurances where you have to be like really bad. You have to like score in order to be approved. I hate those, and I've worked with those before, because most of them, in order to get the scores have to be on permanent teeth. Well, guess what? By the time we botched them up that bad, when we could have just done some expansion when they were 7 or 8 and never had these problems. So it's like, let's not do anything to get them so bad that now we just have to pull teeth and make them function and look terrible for the rest of their life and probably not breathe well. Yeah, that's a great choice. That's terrible. It's terrible. That's one of the reasons why I stopped practicing in the state I was at, because I was working at underserved communities, but this was just terrible. It was heartbreaking sometimes. These kids couldn't get their ortho treatment till they had all their teeth in, so they could get the score. But by then they were so botched, we had a terrible outcome. Whereas we could have just had a great outcome had we just done an expander when they were younger. So, which costs $150. It's stupid. So, anyways, occasionally I have done LMNs. These are situations where they had an underlying medical condition, um, or underlying medical issue, and there was no other way to make them function and be like, orthodontics was the magic bullet that would change their life. Like, we've tried everything else, there's nothing else we can do. So let's go over an example. I mean, I don't know. Um, it's there's a few situations where these type of things happen. Um, maybe they have a small maxilla. The mixed maxilla just didn't grow. It's just really small. Obviously, the more information you can get that proves, hey, we can do orthodontics, or we can wait and do a $50,000 to $100,000 surgery in a few years. Let's do orthodontics. So we want this issue to prove that this patient's health or lifestyle is going to be better. We have to have proof. That's the point. The letter does nothing. Me writing a letter does absolutely nothing. The letter has to come with proof. Now, I put the burden of proof on the parents. So if they want me to write this letter, they're going to have to go find me proof, get me everything. So we're going to talk about it. And this is one of these things where these can take hours, these letters, these consults, these meetings, trying to get them all ready to get treatment before you even collect a dime. Hours. I mean, a lot of work, which is why I really do think the way that we're being compensated for orthodontics is not right. And I really think we should all be fee for service. Um, it's absurd. Or we should be able to charge an office exam fee for this type of stuff every time. This may take 5, 6, 7, 8 appointments just to get ready to even get orthodontics. It may take years. Each of these appointments, I should be compensated for my time if I'm having to do all this stuff. But anyways, okay. So let's say little Susie here. She's 8 or 9. She has a tiny maxilla, pretty common in 8-year-olds. If it didn't grow right, it just didn't grow right for whatever reason. Her maxilla didn't grow wide enough. It didn't grow forward enough. Could have been diet, could have been genetics, who knows. Um, you know, her bite is messed up, obviously, because her upper jaw didn't grow right. She has an underbite. But, you know, at this point, mom can't afford orthodontics, and they're just waiting. And they know if they wait, they're going to have to get $100,000 surgery later. But little Susie is struggling. She's struggling in school. She's struggling. She's wetting the bed. I'm just saying things that may be happening that are, I'm not saying they're directly related, but they're indirectly related. But let's get a whole list of all the maladies that little Susie has. And this is where I want to know everything. So I'm going to do an OMT screening. I'm going to send them to OMT, and they're going to have to pay for a functional assessment, and they're going to get that whole screening report, and I'm going to put that in my letter, because we have to phone our friends and we have to have official reports from as many things going on as possible. I'm going to send her to ENT. I'm going to get a letter. I'm going to send her to get a CBCT. I'm going to have it read by an OMFR. I'm going to do an airway report. I'm going to look at the condyles. I'm going to look at everything. And I'm going to put this all in the report, proving that little Susie has a small maxilla. She is suffering from all these things, and all these things turn back, in terms, and maybe she's small. I mean, there's so much that goes into orthodontics that's indirectly related. If our airway is not good enough, right? Our growth is not going to be good enough. All these things, they may not be related, but they may be related. Let's get as many letters from as many people. You can also get a letter if they're saying that she's not behaving well in school or she has ADHD. Great, we're getting a letter from the teacher. Mom's going to have to go get it. This is not my job. This is mom's job to advocate. I am not doing the legwork here. I will write the letter. Mom will get me all the documentation so that I can write the letter. Mom's got to go to school. Mom's got to get a letter from the school counselor. Mom's got to get a letter from the school SLP. Mom's going to get a letter from the teacher. Mom's going to get a letter from the pediatrician. Mom's going to get a letter from the Girl Scout leader. Everything who says she's misbehaving. Everything. The coach. Everything. Okay? You compile it into one letter, proving without a doubt that this procedure would change this child's health and save the insurance company, you can look at it this way, money for the rest of their life. This is all it is. That's all the LMN is. You prove without a hint of a doubt that if we did this procedure and if they paid for it, this child would be healthier for the rest of their life, and it would hopefully, save them money. That's it. That's the only way. So if you do that, often these things can get covered. Honestly, if you don't want to deal with it, I recommend sending these patients to craniofacial or to an orthodontic residency program. That's what you do, because they do this stuff night and day. They know how to do it. They need these cases in order to get their licenses. They need the points. So send it to the dental schools are incredible at getting these elements done. And honestly, they have a much higher approval rate because I think there's a lot of just respect because it's coming from a university program. So honestly, if you want the best chance of this working out, send them to a dental school and then help them. All right, thanks.